Hi everybody, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I'm going to talk about the use of prior authorizations and referrals in your practice when it comes to billing. Prior authorizations are a necessary evil in a practice, and when you say that word, a lot of people roll their eyes and go, oh yes, prior authorizations, oh, referrals, yes, and it's just one of those things that are required and you have to have a workflow. I do have a video about prior authorizations, so make sure you check that out, but a lot of people aren't 100% sure how it really plays into the billing part of it. So that's just kind of what I want to talk about today. And this is just a very quick high-level overview. It's not going to have a ton of detail. It's just the basics in order to help you have a little bit of understanding. So if you hear more about it or you want to learn more, you'll have a foundation. Prior authorizations are approvals that have to be obtained from insurance companies for services, imaging, prescriptions, supplies, etc., that providers have or feel are necessary for a patient in order to treat them or figure out how to treat them. And the insurance companies, for whatever reason, have labeled this specific thing as needing a prior authorization. Usually it has to do with the cost of the item or the service, and so they want to make sure kind of they're regulating that and wanting to make sure that it's just not being ordered for no reason, and they are kind of, in my opinion, micromanaging the situation instead of trusting providers to make the best decisions for their patients. But that's a whole nother topic I could do a video on, an opinion piece on that. But basically, in order for some of these things to be covered by insurance at all, you have to get a prior authorization. And you would do this on behalf of the patient. And there's oftentimes certain criteria that's required for different things: diagnosis codes, step therapy, how long it's been going on for, what are you hoping to benefit from this, etc. And then it's, has to go through this whole process at the insurance company, and they might deny it, and then the provider has to appeal it. I mean, it's just like this huge thing. They might call on the phone wanting more information or send a letter asking for medical record documentation further. I mean, there's just so many things. But anyway, once it's approved, you're granted a prior authorization number and usually a date span of how long it's good for, 30 days, 60 days, whatever. And so those services have to be billed within that time frame in order for the insurance to cover it. Now, mind you, a lot of patients have the misconception that by getting a prior authorization, it means it's covered at 100% and they're not responsible for any costs out of pocket. And that's where also some confusion comes in, because they don't understand their benefits and they think because the doctor goes to bat for them and the insurance approves it, that it's not going to be costly to them. And that's not true. Unfortunately, if it's a prescription on a certain tier, it might be still super expensive to them. If it's in imaging, it goes towards their deductible. It just depends. So it's really good to make sure that when you tell a patient you need to get a prior authorization, that they understand it doesn't mean it's covered at 100%. It just means that they're going to basically allow you to order this, whatever it is, on the patient's behalf in order to treat them, investigate further of what's going on, etc. Now, referrals are a little different. There's different types of referrals. There is a professional referral where your office might just require referrals from a primary care or a referring doctor in order to schedule these patients, just to make sure that you don't have patients just kind of willy-nilly coming in and seeing you as a specialist. Or maybe their insurance requires the referral, and in that case, the referring provider's office has to apply for the referral to your office, and you wouldn't be seeing that patient until you got the formal approval from the insurance saying, yes, it's okay for them to be seen at your office. And so this is very similar to a prior authorization, but it's definitely different. A lot of times referrals will authorize a certain amount of visits within a certain amount of time, or they will say it's good for the rest of the year of 2023, but then in 2024 you need to renew it. I mean, so there's a little bit more flexibility in referrals as far as how long they last. It's not usually like one and done and you'd have to get another one. Usually it's for a certain time frame, assuming the referring physician requests multiple visits or a longer time frame. But again, this is necessary if the patient's insurance requires it. Now, for prior authorizations and referrals, you're asking, well, how does this work with our billing? It's a very good question. If you are the one to bill out the services that were approved, whether through a prior authorization or a referral, there is a spot on the claim where you need to put that prior authorization number or that referral authorization number in order for the insurance to cover that visit. They're going to look at the date of service to see if it's in the time frame allotted and go from there. So it's really important that there is some kind of workflow, communication in your office of where those numbers are stored, how they get pulled into your claims, how to track the number of visits approved. So if it's a referral and they approve 5 visits within the next 5 months, how are you going to track that? Because it is your responsibility. Is there a tracking system built into your EMR system? Is it something that's going to have to be manually tracked? Do you have a specialist, like a referral specialist, that should be doing that? Is that the front office responsibility? What happens, or when should they be notified, or who to be notified once those numbers are getting low and need to be renewed? Those are the kinds of things that need to be worked out, especially if you're in an office or a specialty that requires a lot of prior authorization and referrals. The nice thing about a lot of prior authorizations is it's usually for medications, which in case you're not billing, that goes through their pharmacy benefits, so it would be on file at the insurance company and you don't have to do anything. It's always a good idea maybe to fax it to their pharmacy, the approval, so they have it on file, but other than that, you're not billing for it, so it's okay. Same with diagnostic imaging prior authorizations, MRIs, CT scans. If you don't do those in your office and you don't bill out for those, then you don't have to worry about it. Obviously, there are some specialties that have that equipment and do those images in their building, in their setting, so you would have to include those numbers in order for it to be approved. There are times you will bill out for services and you will get a response on an ERA that says there's no prior authorization on file for this service. And it might be something you didn't realize needed a prior authorization, or I should say no one else in the practice realized needed a prior authorization. So in that case, you go, oh no, we didn't know this. And you hurry up and kind of backtrack and you figure out what service it is, what insurance, which plan, why, etc., so that any future patients that are needing it have that information before you try to bill it out, because a lot of them won't retro cover. So if you don't have that prior authorization already approved by the time you bill out those services, or that referral approved when you bill out for that office visit, and you get kind of stuck with your pants down because it comes back denied saying no referral or prior authorization on file, they won't retro cover it. They won't go, oh yeah, oh you just got it now, oh okay, yeah, we'll cover it. Unfortunately, they don't do that anymore. Some might, but it's very unlikely. They used to do it all the time, and I think that's just one of their next steps of, really coming down hard on practices and making sure you're doing your due diligence and understanding your responsibilities when it comes to all of this. You want to make sure in your practice, if you're doing stuff that's high dollar, that you're dealing with HMO plans, because oftentimes HMO plans require referrals and prior authorizations. You know what's required for which services, and you don't let patients schedule those in your office until they're done, until you've received that authorization number with that date range. It's your job. So it's really important you have someone in your office that understands those payers, that understands your services and what the requirements are, so that you don't eat a lot of these visits and not get reimbursed for it. If you have any questions or comments about this, please leave that in the comments below. I'm really curious to hear if this is kind of new information for people, or if it's something you haven't really thought about, with all the other stuff trying to figure out for starting a practice or running a new practice. I am just curious, so I would love some input from you. Smash the thumbs up button if today's video was helpful, and subscribe to my channel if you haven't already. Thanks so much, you guys, and also share my video with anybody and everybody. Take care of yourself. We'll see you next time. Bye-bye.